Hello, we're going to do some shockwave treatment today. We've just examined Matt, who's our massage therapist. Matt trains pretty hard in the gym. He likes to compete at CrossFit. You've been having this problem for a while?
Yeah, about 6 months or so.
6 months. It's a problem with the lateral epicondyle, the muscles inserting into that area. We've just examined Matt and found that there's no other issues in terms of neurology or orthopedics. A little bit of restriction in the lower neck and thoracic, so we might just do some adjustments to help with the function around the shoulders and scap as well. But essentially it's this localised soft tissue problem. Shockwave has been shown to be particularly good with chronic soft tissue injuries that won't resolve with rehab or rest or physio. So we're going to give it a go over the next few weeks, and we're going to video the progress as we go on and see how Matt progresses, and hopefully it will resolve it. So,
yeah.
All right. So we're just going to have a quick look at the machine before we start the actual treatment. We're using the Zimmer Shockwave, and it's very handy in that it's got all the protocols actually programmed into the machine. So you can see here for lateral epicondylitis, which is what we're going to treat. You're looking at 2 sessions, or 1 to 2 sessions a week really, for between 4 to 8 treatments. And then obviously you monitor progress as you go through that. But generally what you do after the sessions is you wait for around 8 to 12 weeks, and then you have a follow-up, because usually it takes a little bit of time for the actual treatment to see benefits. The main effect of the treatment is that it encourages regeneration and growth of tissue, so new growth of blood vessels, remodelling of scar tissue, that sort of thing. And then obviously you can incorporate rehab techniques as well as the shockwave, and also look at any other functional issues that might be leading to the problem in the first place. And then you should see some improvements over that period of weeks and months for chronic issues that have been there for quite a long time. The actual treatment head, you can see it's quite a heavy item. Essentially what happens is you get a piston type effect. It's a pneumatic air piston. This moves up and down, well, hundreds of times, thousands of times really in one session, and that initiates an inflammatory response. And yeah, it's research has shown that it can be very effective for quite a lot of chronic issues. So let's get started. Is that the spot there?
Yeah.
Okay. Painful?
Yeah.
Very?
That's alright.
Can you cope with it?
Yeah.
It's quite a loud treatment, but as you can hear, the piston is just hitting that tissue. Obviously it's a bit painful to have it done, but you can change the size of the heads or even put a rubber cap on to make it more tolerable. The idea is to focus on the area where you've got the issue. I think Matt's coping with it so far.
Just about.
So we're doing about 2,000 pulses today. You can hear it's quite a quick motion. How are you getting on?
Alright, yeah.
Alright, can you cope?
Yeah.
Is that hitting the spot there?
Yeah.
Yeah, okay.
And there.
Okay. That's your 2000 pulses. As you can see, it's red obviously because we do want an inflammatory response. How did that feel, Matt?
Not too bad.
It's okay?
Yeah.
Tolerable?
Tolerable, yeah.
That's good.
We knew it was working.
Good. So we're going to check the progress over the coming weeks. You can just hear the head cooling down there. I'm going to check the progress over the next few weeks, and if Matt can tolerate it, you can actually decrease the size of the treatment head over the coming few weeks as well, so it's more focal. And then we're going to see how the tissue responds and monitor the progress. Keep you posted on our blog.